Everything was normal for me until I went for my just regular scans. My OBGYN told me, she said, he's got a little bit of fluid on his brain. She wasn't concerned. She said, we see this sometimes. She said, and most of the time it fixes itself. I knew something was wrong. It was my first pregnancy. We had prayed for this baby and prayed for this baby. And I just knew something was wrong.
At the 36-week ultrasound, they noticed at that point that the head was disproportionately small, which hadn't been flagged earlier. So the biggest red flag was that small head size. And then when I gave birth to Anna, my daughter, she was small for gestational age. She was 5 pounds at 40 weeks and failed her hearing tests. And CMV was never mentioned despite those 2 signs of CMV.
The results of the MRI were inconclusive. She had some cysts, which they said were consistent with a torch infection, is what the report said. At the time, I asked if there were any other tests we needed to do and what that meant, and there wasn't any follow-up on that. I didn't know then that when they talk about torch screening and torch infections, that CMV is the C in torch. So we had a lot of different residents and a lot of different doctors every day in our room multiple times. And many times I said, do you think there's any connection between the abnormal MRI and her not passing her hearing? And no one ever made that connection.
I had heard of CMV. I'm a nurse by trade, so when I heard that name, a bell rang in the back of my head, and I thought, I've heard of this before, but I do not think that I ever realized the impact, how common it is, and just how devastating it can be until I was diagnosed, or we were diagnosed.
It's not part of the lexicon that we're taught as pregnant women in terms of avoiding, common things like sushi and alcohol, and now, being told to cancel trips and avoid mosquitoes. That's the narrative that we follow, not that our toddlers could be carrying something.
All of this was so new to us. We'd never heard of CMV. We had no idea how it could affect our baby until, she was here in front of us. So it's been a challenge to digest all of that and care for her and our other 2 small children, with just the unknowns. So.
Typical week, it's pretty busy. My husband and I both work full-time. She has a lot of daily cares that are not typical for a 3-year-old. So we're still having to give her a bottle 3 times a day. We're still washing bottles 3.5 years later. And we have to give her period food from a pouch. That's how she takes the other part of her daily nutrition.
We had difficulties his first 2 years, really his whole life, but it's gotten easier now. He's had neuro problems and pulmonary problems due to the CMV, like cerebral palsy and aspiration pneumonia and dystonia. Right now, Jackson is 3, and of course we still deal with the same things, but it's gotten much better, and I'm hoping it continues to get better with therapy, keeping up with doctor's appointment, maintaining medications, making sure they're right.
I feel like the hardest thing for me is to focus on her and enjoy the moment rather than worrying about what could happen or what might happen, just because of the unknown.
I would like doctors to provide women with foundational information regarding congenital CMV. I believe women have a right to know what can affect them in their pregnancy and then do with that information as they choose. We talk about toxoplasmosis, we talk about rubella, we talk about Down syndrome and spina bifida and fetal alcohol syndrome and all of these things that have less prevalence than congenital CMV.
Being aware that it's a ubiquitous virus, it's in nearly 1 out of 3 toddlers, is something that we have a right to know. And women can choose from there how they go about avoiding it or kissing their kids on the head. But I think the withholding of information is denying us a basic human right.
This is something that's so common, yet no one I've talked to has ever heard of it. It blows my mind that people don't know about CMV. And even our physician was just, he did research after my daughter was born, and he started to learn a little bit more, but there's still so much to be done.
Congenital CMV is the most common infectious cause of birth defects in the United States, and 91% of women don't know about it. Spread the word, not the virus. Ask your doctor about CMV and visit nationalcmv.org to learn more.